Hello. Okay. All right. Well, welcome everyone to our fourth CCSP Resource Fair meetup. Like I said, it's the fourth one in our series. We will be presenting on mental health resources for patients. This meeting is co-hosted by the Colorado Alliance for Patient Navigators and Community Health Workers with support from the Patient Navigation Training Collaborative. I'm going to go ahead here and share my screen. All right, can everyone see that? Just a nod.
Looks great, Rena.
All right, thanks you, Andy. All right.
There's a lot of logos if that's what we're looking at.
Yeah.
Okay, good.
Oh no. Okay. What do I want to do? I want to share, don't I? Okay, well, we'll just start there. All right, so my name is Rena Solar. If you haven't attended one of these before, I'm the program coordinator for the Colorado Cancer Screening Program. CCSP is a statewide program that is coordinated through the University of Colorado Cancer Center. We partner with safety net hospitals and clinics to support their teams with delivering patient navigation services to the medically underserved with preventative cancer screenings, including colorectal cancer, lung cancer, and hereditary cancer risks. So the purpose of this fourth resource fair is to connect patient navigators, community health workers, and others working in the healthcare community to local mental health programs and resources from community organizations to meet the needs of the clients that they serve. In this meeting, we have two different organizations for mental health. We'll start out with the Office of Suicide Prevention. Conlon Bass will be presenting. And then we will have Morrow from Ray of Hope. And so we'll let them present, and then we'll break out into two breakout rooms. We'll have Office of Suicide Prevention in the first one, and in the second we'll have Ray of Hope. And please save all your questions for that discussion period. I just want to let you know that if you need to have the presentation transcribed or anything like that, if you go, I have enabled it for participants to turn that on, and it's on the lower part of your taskbar for the Zoom. And I will hand it over to Andy real quick with a quick message.
Okay, great. Hey everybody, Andy Dwyer. Interestingly, I have my camera on, but it's just black. So I don't know, it feels, reminds me of that song, I Want to Paint It Black. I'm not really sure what's going on. But I just want to say thank you for Colin and Maro for joining today, because I think it's essential that we really think about approaches for providing opportunities for mental and behavioral health and resources for patients. I guess what I'd like to say is, I know specifically Ray of Hope has the new resource, really considering part of the work. Part of, I think that today we'd like to also get is some input from all of you about what type of approaches should Ray of Hope, who's developing the specific resources that they're providing through counseling services. There's some great opportunity to really inform the work as well. So I know when we go to our breakout sessions, we want to hear about the resources and opportunities, but I think if there's feedback, especially for the Ray of Hope team in Maro, we would really welcome that, because I think they're really open to really thinking about the best way to implement programs and those who are in need. So I'm really excited because we really opened up this opportunity as a great place to connect patient to resources. But I think having all of your voices around what's working, what's not working, what type of input would you provide for people who are able to reshape or reshift programs? That's also going to be imperative as well. And so Mara and I have had some direct conversation about that. Colin, you and I haven't necessarily, but I do just want to say, as much as we can inform what's being put forth as a resource, the direction, but also if you see a specific need through the Alliance, CCSP, and all of our programs, we want to try to be responsive to that. So a million thanks for joining today. Rena, you've done an amazing job of keeping us connected and really are excited about the resources available. So I'll turn it back over to you and our presenters to get jamming.
All right, thank you. And I'm going to stop sharing my screen here. And Conlon, I will pass it over to you to share your screen.
Thanks so much, Rena and Andy. Let me bring up my presentation here. Apologize for the ridiculous amount of tabs you will see for a second. But I just figured today it would be helpful for me to give a quick overview of what the Office of Suicide Prevention's work looks like in our state. And then a little bit more relevant to the work you all do, a deep dive into the Zero Suicide work, which I am the coordinator for. So it's nice to meet you all. Thank you for having me at this resource fair. Glad to be able to plug our resources. My name is Conlon Bass. I use he, him, his pronouns. And I got my NPH from the Yale School of Public Health in 2021 and have been working in this position for just under a year. So I wanted to give the caveat that a lot of the work that I'm talking about relevant to the OSP, the Office of Suicide Prevention, and Zero Suicide happened before I was on board. So wanted to give kudos to my amazing team at OSP. But yeah, just going to give you a brief overview of what our work looks like and then talk about Zero Suicide. And in the breakout session, I will hope to flag some resources that will be helpful for your practice and what your work looks like. And I'm also interested in hearing from you about how your work might intersect with Zero Suicide and flag some resources for you all to use. So in all of our presentations, we start talking about suicide and stigma. We know that this is a really sensitive topic for folks to be talking about, and it's important to kind of have a shared language with suicide. So to try and decrease the stigmas associated with suicide and those who experience suicidality, we offer the following suggestions for how to talk about it. So there's been a movement to move away from using the phrase committed suicide and instead say died of or died by suicide, just because it implies less guilt. The phrase commit has a really negative connotation that we want to steer away from. And you can see here on the right-hand side are other phrases that are really common when referring to suicide. On the left are some alternatives that are a little bit more person-centered and more descriptive of what's actually happening versus a little stigmatizing. So you can see on the left-hand side, suicide, death, and attempt versus describing a suicide attempt as successful or unsuccessful. So just some thoughts there, food for thought. We always lead with this context as well, that statistics are merely aggregations of numbers with the tears wiped away for a couple of reasons. One, our office deals a lot with statistics, looking at what these numbers look like in our state and why. But also remembering that any statistic that we share with you is a person lost to suicide and a family affected and a community member, a friend, a neighbor that has been influenced by this issue. So just important to keep in mind with this high level data. On the right-hand side here, you can see that for every one death by suicide, there are 3 hospitalizations, 9 emergency department visits, 27 non-medically treated attempts, and 228 folks that will experience suicidal ideation. And each year, 12 million adults will seriously think about ending their life. 3.5 million will make a suicide plan. 1.4 will make an attempt. And in 2019, almost 48,000 deaths were reported. While these statistics are concerning and these numbers are high, it really does go to show that there is a lot of intervention and prevention work that can be done in advance of a suicidal crisis, and that recovery and resilience are the true norms. So many people experience suicidal despair or ideation without ever dying by suicide, and there are so many opportunities to help folks live lives that are fulfilling and instill that hope in patient interactions while we have the chance. I'm going to skip over some of these slides here, so I apologize for the whiplash, but want to get into the zero suicide work. But again, just want to emphasize that zero suicide as a framework and our overall office's work really does focus on stories of hope and resilience and trying to promote those protective factors that help people recover, knowing that suicide and suicide prevention are community issues and that prevention, intervention, and postvention are all part of the work that we do. So we have many state initiatives that work in very different areas relevant to preventing suicide. And in the breakout, I will flag some of these other programs that we have as resources that you can use or plug into based on your work with patients. But zero suicide work falls under part of our comprehensive suicide prevention approach, namely improving access to and delivery of suicide care. So we have a lot of different suicide prevention strategies we use as an office. Again, working on reducing stigma, promoting those protective factors and resilience, providing access to mental health care and connections in communities, working on collaborative safety planning with patients, and looking at follow-up and caring contact, like those care transition pieces that are really important and helping people stay connected to care and their community. There are a variety of data resources that are accessible to you at all times. Should you be interested, happy to kind of dive in if folks think that would be helpful. But getting to zero suicide is grounded in these facts. So people at risk for suicide are falling through the cracks in our healthcare system. The framework calls out that in the month before their death by suicide, almost half of those folks saw a general practitioner, 30% saw a mental health professional, and in the 60 days preceding their death, 10% were seen in an emergency department. So the zero suicide framework sees this as a core responsibility for our behavioral healthcare systems to make an effort to intervene, given that they are interfacing with these individuals on a daily, weekly basis when they may be nearing or in crisis. Part of this work looks like training. So knowing that many clinicians, even those trained directly in mental health care, don't feel that they have the skills to engage and assist with those at risk for suicide, don't have the tools and language to be able to talk about these things, or the resources to refer folks out once risk for suicide has been identified. Zero suicide is a quality improvement framework that walks health systems through a variety of areas where they might improve their care relevant to suicide. So again, this looks like a lot of different things and specific to the work that you do. Not all of the framework might be as directly applicable. However, there are a few key elements of the zero suicide improvement framework where the Office of Suicide Prevention can offer you resources, ongoing support and TA. We have free licenses for various trainings and programs, and also serve as a connecting hub for the many facets of this work going on in the state. Really quickly, at a high level, these are the 7 elements involved in the zero suicide framework. So that involves leadership of a health system being looped into this effort and prioritizing suicide prevention, identifying folks through standardized screening and safety assessment tools, engaging folks, and I think this is where a lot of your work will come in a suicide care management plan, which can include safety planning and talking about lethal means and connecting to resources in the community, and then also different forms of training relevant to your role and how you might be working with folks. And again, following up with people, looking at quality improvement and data collection efforts and how what you do can be used to inform those things. Again, in the breakout, I'll talk briefly about safety planning and lethal means counseling. So these are 2 very simple, very quick interventions that really can make a life or death difference with patients. Safety planning mostly identifies a support network and easy, tangible steps that someone can take when they feel they may be nearing crisis to get them help or make the situation less intense. And counseling on access to lethal means is another clear way of intervening with folks and opening the conversation about being safe in your house, in your environment, in your communities. So I will definitely be talking about the host of free trainings and resources and tools in these areas for zero suicide and otherwise related to your work in the breakout. I can also chat more about what our zero suicide work looks like broadly, but we'll use the breakout to share our resources, provide a bunch of links in the chat that might be helpful, and again, just hear from you about what might be helpful based on how you interact with patients. I know I only had 7 to 10 minutes, so I'm gonna stop myself and let the other crew go, but thank you so much and looking forward to chatting in the breakout.
Thank you so much, Conlon. Just so everybody knows, we will be providing all of the slides and the recording from today. Colin, I know there's so much information, so thank you for sharing all of that. And I'm going to go ahead and turn it over to Mauro and let you present about what Ray of Hope is going to be introducing soon.
Good afternoon, everyone. My name is Mauro Villaseñor. I'm the Program and Operations Director at Ray of Hope Cancer Foundation. So a little background about the Ray of Hope Cancer Foundation. So who we are. So the Ray of Hope Cancer Foundation was established in 2002 by oncologist Dr. David Schreier. Our mission is to respond to the urgent needs of Coloradans with cancer by providing financial assistance with dignity and humanity. And our vision is that no Colorado cancer patient in need will go without support. So that being said, Ray of Hope launched a new program this year, the Mental Health Support Program. So Ray of Hope Cancer Foundation is committed to helping remove the barriers to mental health support for cancer patients, their family members, and caregivers due to a cancer diagnosis, disease progression, or loss of life. We seek to facilitate access to top pre-screened counselors looking to work with families touched by cancer and help cover the costs for those that are not otherwise able to pay for their care. So how are we doing this? So Ray of Hope is doing this by 2 parts. So part 1 is kind of a landing page. So the program offers a dedicated site for cancer patients, their family members, and caregivers to help find mental health support due to a cancer diagnosis. So Ray of Hope's list of providers are licensed in the state of Colorado, have clinical experience in behavioral medicine and oncology. So basically, it's this landing page that lives on our website. You can see the current professionals that have agreed to participate in our program. They list what type of coverage they take, insurance, Medicaid, Medicare, and if they're taking any patients. So that was part 1. So part 2 is actually that Ray of Hope is actually offering a grant. So the mental health program is focused on breaking down the barriers to mental health for cancer patients that are underinsured and underserved, low-income individuals, their family members, and caregivers. Individuals that qualify as underinsured or low income will receive a grant. So this grant will cover 6 to 8 sessions per patient, depending on the therapist they choose. Also, a thing to keep in mind with our program is that Ray of Hope does not collect any contact information from the applicants and guidance with HIPAA privacy laws. So I'll explain more on how we're doing this in the breakout sessions, and also a little bit more about how to get a grant. So our goals is to raise awareness of the importance of mental health and the challenges that exist when cancer diagnoses are introduced into a family, break the stigma associated with asking for and receiving mental health support, provide mental health services via licensed providers for those that would not otherwise have access. So we launched the actual grant portion of the program in March, and we have been piloting it with Rocky Mountain Cancer Centers. And in the breakout sessions, I would really like to discuss the success and where we're at with the program, and also get some of the feedback from the community on how we can tweak it before we go live. Just really quick, these are some of the other programs Ray of Hope offers. If you have any questions about any of this, you can please feel free to email me or give me a call, and I'll toss it back to Raina. Thank you.
All right, thank you so much. Okay, so it looks like we'll have a little bit more time than we usually do for the breakout rooms and discussions. So I know that we have a lot to talk about, so I'm going to go ahead and open those up. Remember, you get to choose one, and then after about 10 minutes or so, I'll bring you all back and then I'll reopen the breakout rooms for you to either stay in that one or choose to go to the other one. All right. And please put in the chat if you're not able to see the pop-up for letting you choose a breakout room. But it should be open now.
I'm not seeing the link for Ray of Hope. I see the 2 suicide prevention ones. Oh, wait, nope, I got it.
Sorry, yeah, you might have
I
to
got it,
scroll
yeah.
all the way down there. It's good we have a lot of participants, but yeah, you kind of have to scroll a little bit.
I would like to join the Ray of Hope group, but I don't know how to do that.
Let me do that for you.
Thank you.
I'll just assign you. You said Ray of Hope, correct?
Yes. Thank you.
Yeah, you're welcome.
Hi, Raina, it's Stephanie. Can you please put me in the Ray of Hope?
Stephanie, yes.
Thank you.
You're welcome.
And this is Julie Reinbarger. Can you put me in the suicide one?
Yes,
Thank you.
you're welcome.
This is Gayla Lovato. Can you put me in the Ray of Hope?
Yes.
Thank you.
Could
Sandra.
Hi, Raina.
Hi, how's it going?
Yeah, this is Ivy. Could you put me in the, is it the suicide prevention one?
Yes. You have 2, so I'll just put both of you in there.